Hello, I'm Dr. Alex Samuel. I'm the Chesterfield Health District Director. This district includes Chesterfield and Powhatan counties in the city of Colonial Heights. There's been a great deal of media attention about the current coronavirus disease, which is also identified as COVID-19. As a region, state, and across the nation, public health officials are working together to address COVID-19. I'm here to clarify information about how the virus is spread, the symptoms, and what we know about the disease. I also want to stress that even though cases have been reported in Virginia, the health risk from the virus is considered low. First noticed in the city of Wuhan, China in December of 2019, COVID-19 is caused by a new strain of coronavirus, which is a broad category of viruses. Some strains of coronavirus are responsible for the common cold. The COVID-19 coronavirus is believed to have jumped from an animal source to humans. It's spreading because we don't have natural immunity to fight it. Scientists around the world are working hard to develop a vaccine to protect people against COVID-19. So how is the virus spread? COVID-19 is thought to spread between people who are in close contact with one another when an infected person coughs or sneezes. The coughs and sneezes produce respiratory droplets, which can land in the mouths or noses of people close by, or possibly be inhaled into the lungs. It's also possible to become sick by touching a surface or object that has the virus on it, and then touching your own mouth, nose, or eyes. Illnesses caused by the coronavirus produce symptoms that range from mild to very severe. Illnesses with severe symptoms, in rare cases, may result in death. For COVID-19, the most common symptoms include fever, cough, shortness of breath, and it is important to contact your doctor immediately if you develop these symptoms and have been in close contact with somebody known to have COVID-19, or if you currently have recently returned from a country with widespread or ongoing community spread of COVID-19. This list of countries is changing frequently. The best sort of up-to-date information is the CDC website, which is cdc.gov. There's still a lot of learning about how sick people become if they catch COVID-19. Information coming from the World Health Organization, based on studies conducted in China, indicate that illness due to COVID-19 infection is generally mild, especially for children and young adults. However, about 20% of those who catch it need hospital care, primarily to address pneumonia or lung infections that the virus can cause. A small subset of these individuals can develop more severe illness, which can sometimes be life-threatening. While we are still learning about how COVID-19 affects all people, there are certain populations that are considered high risk and appear to develop more serious illness. These high-risk populations include older persons and persons with pre-existing medical conditions such as heart disease, high blood pressure, cancer, or diabetes. For most people, the immediate risk of being exposed to the virus that is caused by COVID-19 is thought to be low. The virus is not currently widespread in the United States in general or in Virginia specifically. COVID-19 is a respiratory illness, so prevention steps are very much the same as those you would use to protect yourself from the flu or a simple cold. Recommended prevention steps include washing your hands with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer if soap and water are not available. Covering your mouth and nose with a tissue when you sneeze or cough, and put used tissue in a wastebasket, then wash your hands. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not into your hand. Stay home if you feel sick. If you have a fever, stay home until you are fever-free for at least 24 hours without the use of fever-reducing medications. Avoid close contact with others and seek medical treatment if necessary. If you need to go to the doctor, inform them of your symptoms in advance of your arrival. Clean, disinfect, frequently touch objects and surfaces. Avoid touching your eyes, nose, and mouth. For more information, check the Virginia Department of Health's website or the Centers for Disease Control and Prevention's website. Thank you for watching.